slide already includes the lists of the author. Probably I may not spell out them individually, so I want to go to the next slide. Why it's not moving, this one? Okay, thank you. As a background, there have been a lot of literature worldwide that actually, gives us information about the influence of the media for our opinion construction as well as the health behavior change. In Nepal as well, there have been a few data about the use of media by women. For example, if we look at the data of DHS, 50% of women watch television, 28% listen to the radio, and 9% read the newspaper. However, there have been very limited evidence that actually tells us about what is the relationship between the media exposure and maternal health outcome. I mean, how this phenomenon, these two phenomena have been interlinked with each other. What is their association? So in this context, we conducted this study, and we actually aim to compare the social determinants, risk behavior, and service utilization among women, those who use the media and who do not use the media. So this is basically the secondary data analysis, and the data source is the MIX 2019. As you know, MIX is the International Household Survey Program that actually provides the data, the latest data on the situation of women and children. So our sample size is 1320, which has been mistakenly placed here, so I want to correct. There are three types of variable we have mentioned here. I do not want to individually name them. However, they have been, I have been categorized in three categories. The dependent variable, that includes the risk behavior and the service utilization. Independent variable includes the media use, and background variable includes the socio-demographic characteristics of the women. We extracted data in SPSS and converted to our program and conducted statistical analysis that includes the descriptive analysis, bivariate analysis, and logistic regression. So I don't want to go to the detail. And ethical approval was not required for our study because this is based on the secondary data. So this is the result. The mean age of the respondent was 29.81 years. We found that around 2/3 women resided in the urban area, and 30.6% of them resided in the rural area. And highest proportion of women were from Bagmati province, followed by province 5 and least in province 2. So majority of them belonged to the richest quintile, and more than 1/3 had completed their secondary educations. Majority of the women had access to the health insurance, and majority of them were currently married, and 22.4% were never married. So my upcoming slides are loaded with so much data and statistics, so I'll try to interpret it in a more simpler way. Our result found that this slide shows the use of media by women. We can see here the proportion of the women. So I mean, this slide explains in better way, I guess. We can see here the number of the women who use any media at least once a week had the highest proportion, followed by those who watch television, and that is 58%. And the least is the women who read the newspaper. Okay, this slide provides us the information about the media use based on the social determinants. As you can see in the slide, media use was higher among the women from the younger as populations and from urban area, and more, I mean, as the education level increases, you can see here, more educated women have more media use, and similar result is seen in case of yes, wealth quantile. Okay. So this is the media use and risk behavior. We also found that media use is associated with a different risk behavior like smoking and the consumption of the alcohol. Okay. So in terms of the service utilization, we can see the same results. For example, media use is associated with the menstrual hygiene management, place of delivery of the last child, and the information about the HIV and the test of the HIV. My apology because my slides are overloaded with so many data and statistics, but let me try to explain it a bit simpler way. This slide that compares the risk behavior and service utilization between the women who actually use the media and who do not use the media. For example, you can see here the media user women have higher times of not smoking, higher times of consuming no alcohol, or we can say also avoiding alcohol, instead maintaining menstrual hygiene more and using contraceptive more. And same happens with in case of HIV test and knowledge on HIV. Okay. This is the conclusion. I do not want to read the conclusion individually because I guess drawing from those conclusions, I would like to say a statement that especially when it comes to the media exposure and socio-demographic background of the women, risk behavior of the women, and service utilization of women. So all these three things have been associated with the media exposure. That is the essence of the conclusion of this slide. As a discussion, respected chairs, what I want to flag representing my research team is media use is not absolute because when you talk about the use of media, a lot of factor matters. I mean, for example, if I have a television set in my home, who actually controls the content of the media, who has the ownership of the media device like radio, for example, this is the portable, the communication means. So at a time when we are discussing about the health system resilience or resilient health system, we cannot really ignore the health communications that is very vital in terms of educating women and changing their behavior in terms of avoiding the risk behavior and increasing the service utilization. So that is quite important, and this finding might have implications for future research. So I want to flag these issues, and I want to conclude my presentation. Thank you so much. Thank you.
Thank you so much, Shreeman ji. तपाईको यो very interesting. Shreeman ji भन्दा पनि रमाइलो लाग्ने रहेछ. ओके, यहाँ बसेर है. यो media exposure र त्यसको effect, cause and effect, kind of तपाईले नोटमा पनि पछि भन्नुभयो who controls the media equipments at home, त्यो तपाईले आफै रेज गर्नुभयो. And then internationally in the research there is always an issue, the pathways of the effect of exposure to media and the impact on certain behaviors. त्यो छ, तपाईले एउटा पार्ट हेर्नुभयो. I am sure our distinguished audienceहरुमा a lot of questions होला त्यसमा. Thank you so much for your presentations. Now I would like to request my co-chair to actually open the floor and take the questions and discussion.
First of all, before I open to the floor, I'd like to congratulate this distinguished panel of 6 speakers for bringing the most relevant issues, research-based issues, which are critical to the theme of this summit, to develop a resilient health systems in Nepal. And I will save my other comments because given the time constraint, I have noted each one of your contribution, I'll come to that after what the distinguished audience has to comment on your presentation. Thank you so much. With this brief comment, I would like to open a lively comments and discussion from the distinguished audience of the floor. Thank you.